My name's Sarah O'Brien. I'm from the Quality Assurance and Compliance team, and welcome to this week's Right Way Wednesday. Today we're going to be talking about particularly the Medicare Part A diagnosis selection process and also some tips for talking with your MDS coordinator. So as we know, the Part A Medicare patient comes into the facility with a list of medical diagnoses, and that diagnosis list is where you're going to be getting your medical diagnosis for your plan of care. Sometimes the MDS coordinator will come in with a shortened list of medical diagnoses for you to use for your plan of care, but that's something that we'll discuss a little bit later. What you want to be sure that you're not doing is using the medical diagnosis as a general diagnosis only to narrow it down with the treatment diagnoses. What I mean by that is take, for example, the dysphagia unspecified as a medical diagnosis, only to narrow it down to dysphagia or pharyngeal phase for the treatment diagnosis. That's not really how everything works. So we want to be sure that we are really looking at the reasoning. The medical diagnosis is the reasoning behind the treatment diagnosis that we've selected. So the reason that we're treating that patient for difficulty walking or for dysphagia or abnormal posture, whatever it is that we've selected for our treatment diagnoses. So for a very specific example of that, a medical diagnosis of I63.031, which is cerebral infarction due to thrombosis of right carotid artery, that is a very specific medical diagnosis, and R13.12 is dysphagia or pharyngeal phase. Now that is the treatment diagnoses, and the medical diagnoses, the CVA, is the medical reasoning behind the dysphagia for the treatment diagnosis. Now, if your MDS coordinator is giving you medical diagnoses that you feel are inappropriate, for instance, UTI or hypertension, or you feel that are just like way off base for that patient, you definitely need to make it a priority to ask your MDS coordinator or your rehab director to look down or look at the medical diagnosis list for other medical diagnosis possibilities. Because as I said earlier, there is each patient does come in with a full list from the hospital, so there should be other possibilities there for you to select from. So this MDS coordinator, sometimes some of you might be thinking, this person is someone who always gives me my codes and is someone who tells me that I really don't have a choice. But I would really challenge all of those rehab directors out there to go ahead and set a time, a meeting time with your MDS coordinator, and try to have a discussion about how you might be beneficial in the ICD-10 selection process, and how it might make the end of month billing easier, the triple check process quicker. It would reduce the chances of denials and possibly even make their job a little easier in the end, because they would have another set of eyes on those codes. So I really throw that challenge out there. So I hope that this gives you a little insight into what we're looking at for those medical diagnoses, and also gives you some tips for speaking with your MDS coordinator. If you have any questions or anything, please reach out to us at denials@heritage-healthcare.com. Check out CEU 360, where we have tons of speed trainings and demonstrations of standardized tests now up there for you to look at. And always check out our Documentation Success Facebook page, where we have great discussions going on from us and your peers. Thanks so much for tuning in, and we'll check you out next week. Thanks. Bye.